Good morning, everyone. We have a few more that'll be joining, but we'll go ahead and get started. So thank you all for being here on day 4. A couple reminders before we start. Um, Please be attentive to our speakers. We ask that you have your cameras on while they're speaking. Go ahead and keep yourself muted. If you're not speaking, use the raise hand function if you'd like to talk. And you can use the chat function to ask and answer questions, and we will answer all that we can, time permitting. So I'd like to start off today with Dr. Tiffany Mims. She's a psychologist with the Rosetta Center for Counseling and Wellness, and she's going to talk about her career in behavioral health. So welcome, Dr. Mims.
All right. Thank you so much. Hi, everyone. Good morning. Good morning. Thank you for turning on your cameras. I know that's not always, everyone's favorite thing, but it does. I think it helps, just to be able to see folks, and it's helpful for me to know if you're engaged or if you have questions or if you're zoning out, then it tells me I need to like move it along or kind of make it more exciting. So I appreciate you all turning on your cameras and also understand if those of you who cannot. So, Sam, we have 30 minutes, right?
Yes, we have until 10:30.
Okay. All right. I am known for just talking and getting going, so I will respect the time. I did put together a PowerPoint for you all just because I know I like to kind of have some visuals to go along with what folks are saying. So I will share my screen with you. And then if you have questions, and I'll also ask you some questions along the way, feel free to either raise your hand or type something in the chat. Sam, I can't always see the chat in the hands when I'm in my slides. So if you see something, feel free to just unmute and, let me know what's going on, okay?
Will do. Yes.
All right, folks, let's start sharing my screen. All right. Thumbs up if you can see this. All right, perfect. All right, so I am Dr. Tiffany Mims. I am a licensed clinical psychologist, and what I'm going to do is just give you a really brief overview about the work that I do or the work that psychologists do, as well as sort of like the career path and some of the questions that people have about like what is my day-to-day work life look like, as well as like how much do psychologists get paid. So and if you have other questions, feel free to ask. I'm very open and I really like for folks to be informed about this sort of work. So, feel free to ask away if I don't cover something. Well, okay, slides aren't advancing. Here we go. Okay. So, just as an overview, under this umbrella of being a psychologist, I do a lot of different things. And so that's sort of what I bring to this conversation. And so, if you have questions about those particular roles, again, feel free to ask. So, yes, I am a psychologist. I do clinical work, which is basically I provide therapy, one-on-one therapy. I do couples therapy, a little bit of family, not a whole lot. And I also facilitate groups. I also own a business, right? And so being a business owner is a whole sort of skill set in and of itself. So I had a private practice that I started in 2007. And then in 2013, I expanded into the Rosetta Center for Counseling and Wellness. It's named after my grandmother. So I also, run my own business. I've been a professor as well, particularly at the graduate school level. So those are folks that have really committed to the field of psychology and are kind of building that career. I've also been a supervisor. So when you're in graduate school and you are earning your degree in psychology, you have to do clinical work. You have to do like a practicum, which is basically like you're doing the work, but since you're not licensed yet, you have to have someone to supervise you. So I've done that as well. And then I also get hired by different companies or schools or nonprofits to come in and do trainings and workshops around a variety of different issues. And that's something else that being a psychologist has allowed me to do. And then mentoring is also important to me. And so that's partly why I'm here today, because I like to, just introduce younger folks to this field. Just so that you know that this is an option, for you. And even if it's not something that you want to do, you may collaborate and work closely with psychologists in whatever field, you go to. So mentoring is also sort of part of what I see as my professional responsibility as a psychologist. Okay. All right. So, what is a psychologist? I'm curious to hear from you all. When you hear psychologist, what do you think a psychologist is? What does a psychologist do? And you can just come off mute or type in the chat. Anything is fine.
Um, is it from what I understand psychologists, it they are kind of like similar to therapists, kind of like what you said, and I know understand they understand brain functions and like how those impact our behavior and our decisions, but it's not like it's more like therapy, I guess, but you can't like give out medications for things like that.
Mhm. Very good. Great. Other folks, what is a psychologist? What do psychologists do? What settings, like where do you see psychologists working?
We have someone in the chat, someone who helps with your mental health.
Someone who helps. Very good. Great. All right. Anybody else? One more? Anybody want to give a guess as to where psychologists work?
Do they work almost like outpatient in their own like businesses, kind of like how dentists work?
In their own practice. Yeah, I'm in my office, right now. And so, yeah. Okay, very good. Thanks. So the answer is all of you are correct, all of the above. Okay. There are a lot of different types of psychologists out there. People don't always realize that, right? So sometimes, people often think that, yeah, we're the people that do therapy, right? Help people with their mental health and wellness. And yes, that is part of it, but the field is much broader than people realize. So, and I won't go through all of these, but I just kind of want you to see like, wow, there's a lot in this field. It's very broad. So I'm a clinical psychologist. So that's the first one that's on there, right? And so, yes, I do work with folks with mental health concerns, all the way from just, daily stressors, right? All the way to more, I don't necessarily work with the more severe and chronic mental illnesses, like things like schizophrenia or, kind of more severe bipolar disorder. But that is the type of work that clinical psychologists do. Very similar to counseling psychologists that you see on there as well. Counseling psychologists tend not to work with the more severe disorders either. And you tend to see counseling psychologists in like university counseling centers and community psychology as well. Okay. But you can see on here, right? Educational psychologist and school psychologist will be on the next slide. But these are folks that you'll see working in schools, doing research about how to support, learning and students and improve educational institutions. Okay. You've got forensic psychology. Okay. This one has grown tremendously in popularity over the years, right? So I'm now that I've said it, probably a lot of you are like, oh yeah, right? Like I've watched some of those true crime stories and things like that. So forensic psychologists look at criminal behavior and often assist law enforcement agencies in criminal investigations, right? Becoming very, very popular. Geriatric psychology focuses on working with older adults, right, with their aging population. Okay. So, and then I'll show you there's even more, right? Health psychology, right? So obviously things like our physical health and our mental health are connected, right? And so some folks focus on improving, right, our physical health, right, because of the impact that it has on our mental health. You might see health psychologists in medical settings, in hospital settings, right? Organizational psychologists work in like what it sounds like, right? In organizations. So helping companies to create environments that are better for their employees, right? Work-life balance, and vice versa, right? So helping employees with their productivity or with finding the right, career fit, right? So there's a lot that goes under organizational psychology as well. Um, oh, and then another one that's becoming very popular is sports psychology, right? There's a lot that goes on with in sports, right? Whether it's your motivation, your performance, recovering from injuries, dealing with some of the high stress and high pressure. So sports psychology is another area. So just wanted you to know that the field is very, very broad and there's a lot of things that people can do. It's not just about the therapy that people often, think about. It's not just working in your office. You can be in all sorts of different settings. Okay. All right. Okay, so how to become a psychologist. Okay, so once you graduate from high school, and there's a lot of different ways, but these are the two primary ways in which people become a psychologist, okay? So you graduate from high school and then you go on to get some sort of an undergraduate degree. Now, some folks start out at a four-year university, right? Others start out at a community college and then transfer to a four-year university, but you get your bachelor's degree. It could be a Bachelor of Arts or a Bachelor of Science, but you get that undergrad degree. And then after that, you would go to either a master's degree program and then into a doctorate degree, or you can go straight from the undergrad degree into a doctoral program, and you kind of get that master's degree along the way. So neither way is better or worse. They're just different pathways. And although it looks like one, you might get there faster, don't let those lines, throw you off. It's not necessarily shorter or faster either way. It's just a different option. Sometimes people will get the master's degree first and get licensed at the master's level, and then that way they can work while they're getting their doctorate, and it can help pay for the cost of the doctorate. There's some pros and cons to that, but I'm seeing a lot more people do that more recently. Okay. Now you'll see at the end of this pathway, you'll see what's called a PsyD and a PhD. There's a typo there. PsyD and a PhD. Those are both doctoral level degrees, the highest level that you can get in the field of psychology. Okay. Now the PhD is a more traditional degree. It's been around for ages. You can get a PhD in a lot of different fields, and it stands for Doctorate of Philosophy, and then it would be in psychology. Typically, that's known as being more of a research heavy degree. So you'll have to do more research. The type of research is kind of more particular. And sometimes people can be intimidated by that. But one way to think about it is at this point in your career, you've decided what you're really interested in, and you get to study that, right? So it's not a guidance counselor telling you, to take a class that you like don't care about, that you're not good at, that you have no interest in. You get to choose what's important to you and what you want your career to be about. And so the research that you do in a doctoral program is your opportunity to do that. Okay. The PsyD is called a Doctorate of Psychology, and it's more focused on the clinical applications of psychology. And yes, you do have to do research, but the expectations aren't quite as high. It's a little bit more open and flexible. Okay. What's not on this slide is then after all these years of school, you also have to take an exam and do a certain number of hours to get licensed. Okay. So technically, the only person that can call themselves a psychologist is someone who has a doctorate degree and has become licensed. Okay. You may have heard the term therapist. A therapist is someone who can do therapy, but they're typically at the master's level, not at the doctorate. And then to the point that was made earlier, very important distinction, psychologists do not prescribe medication, psychiatrists do. And psychiatrists go through medical school, not a doctorate degree. Okay? Let's see, let me check my time. Oh my goodness, time goes by so fast. Okay, so this is an example. So these are two students that graduated, what, last month, completed their doctoral degree. And these are two students that I taught and supervised and helped with their dissertations, their research project. And they just graduated last month. And this was their path to getting their PsyD. Okay. And so you can see they follow those different pathways from that first slide, right? So Demond on the left in the black graduation gear started out at community college for a couple of years, and he went to two different schools to get his bachelor's. He was an athlete, and so he kind of went where he got really good, sports scholarships. Ended up graduating from University of Laverne, went straight into the PsyD program at CNU, which is over here. Well, there's a campus in Elk Grove and also one in Rancho Cordova. So you can see his trajectory and how long it took him from high school to completion of the degree. And then Kofi on the right in the red went to UConn, big sports school, if any of you follow sports. Took some time off and worked for a couple of years and then entered into the PsyD program at CNU. Okay. So that's an example, two different examples of kind of, how you can get there. All right. So some of these responsibilities here I don't do anymore. I'm not currently teaching, so some of these things wouldn't be on my schedule right now, but I wanted to show you an example of what it can look like when you're doing multiple things. And a lot of psychologists, we like to do multiple things. We might have various jobs because one, because it helps with increasing your income, and two, there's something about the way in which, when you're practicing psychology, plus you're teaching and you're supervising, it all sort of makes you a better psychologist, right? So a lot of us do a number of different things. But this is an example of what a typical day, could look like. So you see, I've got a number of patient hours on there. When I was teaching, you have to be a certain committee. So I'd have a committee meeting. That 3 o'clock hour there is something similar to what we're doing right here. So I've been a mentor with the Y2K program for what, 13 years. And so I might, do some sort of presentation. If I was doing a a consulting project, then I might have a meeting with the stakeholders. And then in the evenings, I'm a parent and my kids are very active. And so my evenings would be spent, on the softball field or soccer field or something like that. So that's sort of what a typical day for me would look like. You can see it's a pretty full schedule. And self-care is very important when you are a helper and a healer. So I wouldn't have this schedule every single day because I would need time for, my paperwork and exercise and things like that, right? But that's just sort of an example. Okay. Let's see here. How much does a psychologist make? Okay, so this is an example again from about a couple of years ago in my life when I was doing all these different things. And I'm very transparent about pricing because I want folks to know sort of what the field really looks like. So if you're seeing patients, right, one-on-one or couples or whatever, a psychologist can earn anywhere from about $70 per session, and a session is usually about 45 minutes to an hour, all the way up to, people can charge, I mean, depending on where you're located, like $300 or more per session. Okay. Now, why such a big range? Well, if you choose to accept someone's insurance panels tend to pay a little bit less. So you might be on the lower end of the scale. But if you don't accept insurance and you just charge whatever rate you want to charge, that's where you see people charging the, 200 plus per session. Okay. And depending on where you live, like folks in like LA, the Bay Area, New York, charge like 300 plus. Sacramento area, it's probably private pay between 175 and 250. Okay. And then, like I said, I was teaching, but I was teaching just part-time. So I would teach one or two classes a semester, just kind of depend. And I was making 45,000 per year for part-time teaching. Okay. And then if you do consulting or speaking, I mean, literally a huge range, right? So some things that I do for the community is just, right, a service that I'm providing, and I don't charge for those. If it's a larger corporation, a much bigger project, the most that I've gotten paid for a consulting project was 25,000. That's not the norm. That's not the norm, okay, for me, anyways. Um, but it's usually more in the range of, I don't know. I did a talk on Saturday, that was $500 for the hour, right? So, so a huge range, right? Depending on what it is you're doing, how often you do it, how you package it, and who you're doing it for. But you can, do the numbers, right? If you're thinking about how much you might want to make in your career, what you want your lifestyle to be like, how much you want to have to be able to contribute to other important causes, you can play around with the numbers and see what might make sense for you. So that's my quick overview about the field, about what I do. Do you have any questions in the last few minutes? And I'll stop sharing my screen so we can see everybody.
Feel free to raise your hand or put questions in the chat. What got you into psychology? Our first question.
Oh, yeah. So, what got me into psychology? Let's see here. So, when I went to college, my mother thought I should be an engineer. And so I went in to college as a math major and then kind of like folded in economics. And I didn't like it. I was not doing well. Grades were not good. And I took a psychology class. It was a Black psychology class, was the title of the course. And I just loved it. It was the first time that I saw my experiences as a woman of color like represented in the school curriculum. And I loved like the language that it gave to my experience. And I absolutely fell in love. And I told my mom, like, nope, this whole engineering, math, sciencey thing is not working for me. I want to study psychology. And she was like, why? What is that? What are you going to do with that? And just kind of talked it through with her. And she's like, well, that's what you're going to do. Do it to the fullest. And so I just dove in all the way and went all the way. And yeah, it's been great. Let's see. Jillian, you have your hand up. Yeah.
Hi, okay, so I was wondering, like, since you do counsel so many people and you probably hear a lot of their problems and you have to take on a lot of like their struggles and their weight, like how do you deal with that? Because I feel when I think of like psychologists and how they have to, I don't want to say like listen to other people's problems, but essentially that sometimes and have to help them. Like, how does
Yeah.
that affect you, like having to take on like other people's issues and having to hold all that in your head?
Sure. Yeah. Yeah. That's a very common question. And honestly, so one, like you're trained, right? When you go through school, you're trained to be available and present and a listener, but to also have that emotional boundary so that you're not taking it all in, right? And also for me, I mean, I guess it makes me feel good to know that I'm helping someone through, right? So it's not that I'm taking it on, but I'm there to kind of help them through whatever it is that they're going through. And that I think helps keep us going, right? And then the other thing is to have boundaries so that you're not working, all day, every day, listening to people's, concerns all day, that you have good self-care, that you take breaks, that you have a life outside of work, right? Otherwise, you can just get pulled into it. So for me, the fact that I'm helping people helps me not get buried in it, and then having a life and activities and hobbies and things outside also help. But then also, I think knowing yourself too, that, for some folks, it might be harder to kind of turn that part off. But you still want to be in the field. That's why I showed the slides earlier that there's a lot of ways to do this work that don't just involve sitting and listening to people's, concerns, right? Yeah. Mhm. Let's see here. We got another hand up.
Hello. So I had a question. This was kind of like multiple questions, but it was specifically
Sure.
with first, do you like deal with the different type of like anxiety disorders, mood disorders, personality disorders? Okay, so you do. Have you
Yes.
ever dealt specifically with a narcissism or a narcissist before?
Yes.
You have. Okay,
Yes.
so the main question that I was going to ask is since like I took psychology and I know like a narcissistic person usually doesn't want to admit that they have, I guess, the disorder. So I was wondering when would you specifically draw that line where you wouldn't offer treatment for people?
Sure. Yeah, yeah. Okay, great question. It reminded me of something else. You're not asking this, but I just want to put this out there. So also know when you take psychology in school, there like you there's so many aspects to psychology, and how they teach it at your school or at a particular college can vary greatly, right? So just sort of know that, like some classes will focus on things like the various like disorders, things like that. Others will focus on health psychology. So just know that when you take psychology in school, it can be very narrow in what they present, or they might require you, like if psychology is your major, they might require you to take a whole lot of different types of psychology, even if they're not directly in line with what it is that you see yourself doing down the line. Okay, now to your question. So narcissism. So yes, so in the DSM, the Diagnostic and Statistical Manual of Mental Disorders, I think that's what it stands for. That's like the big book of all the diagnoses. There's two categories. One is for someone with good insight and someone with no insight, right? So that's someone who kind of is aware that, like, yeah, not really like navigating these relationships so well, and something might be going on, and maybe I need to make some shifts. And other people who are like, what are you talking about? Like, I am great, I am wonderful, everybody else, sucks and needs to fall in line, right? So sometimes we look to see what level of insight the person has, and a willingness to kind of consider making, some changes, right? Navigating relationships a little bit differently. Um, with someone with a personality disorder, whether it's narcissism or anything else, it can be a very long and slow process because, again, just even by definition, a personality disorder, it's what they describe it as being characterological, right? So it's almost just how that person just roles in life, right? So if you can imagine really making huge shifts in just your personality, how like you do everything, that can take quite a bit, right? So I think patience just kind of goes with that particular diagnosis. Um, Not everybody works well with folks with personality disorders because it can be very draining and very slow, and you can get a lot of that sort of like pushback and resistance that you're talking about. Um, when you might say treatment is not warranted, I mean, if you've worked with that person for a very long time and there's been absolutely no change, absolutely no increase in their awareness, then, right, there might need to be that conversation that that this may not be working, or, maybe it's the relationship with that therapist that's not effective. But yeah, that's narcissism. That's a particularly challenging diagnosis that specialists, I think, are best to work with that. Yeah. Mhm.
And then, is there another question in the chat?
Okay, let's see here. What helped me make decisions between being a
There it is.
psychologist, psychiatrist, or therapist? So, I've not historically been strong in like the sciences, like, biology, chemistry, physics, all those sorts of things. And so those are, kind of things that you have to do in the path towards to medical school. And so psychiatrists go to medical school, and I don't think that that would have been a good fit for me. The difference between the psychologist and a therapist. Um, I mean, to a certain extent, I am a therapist because I do therapy, but the psychology piece has to do with having the doctorate degree. And I was, when I graduated from college, I was young and I didn't really know 100% of what it is that I wanted to do. And having the highest degree possible in the field would allow me to do anything and everything. And so, and I saw my mom got her PhD in educational administration when I was in college. And I saw how hard she worked to go to school, plus raise a family and be involved in the community. And I'm like, you know what? I'm young. I have no other, responsibilities. Let me just dive into school, get the highest degree so that I have options, in the future. And that is exactly what that has done for me.
All right. Well, thank you very much. Thank you for sharing your story and for sharing about your career. That was a wonderful overview. I hope it's okay if maybe we share your slides because that was a great breakdown of all the different clinician types that they can look into. So thank you
Sure.
so much.
Yes, you're very welcome. Thanks for listening and asking questions.
All right. All right, we're going to move on to our next group of speakers. So if I can have all of my medical students raise their hand. All of the medical students that are on the call, there we go. Okay, so we have several here. So welcome medical students. We have several medical students from California North State and UC Davis. And so what I'm going to do is I'm going to put you into a couple breakout rooms, and then our medical students are going to share a little bit about their journey, how they got into medicine, how they made that decision, sort of how medical school is going, what year they are, what has been sort of the challenges and the wins that they've had. So I'm going to break you into about 3 breakout rooms. It looks like I have 1, 2, 3, 4, 5, 6. So I'm going to put 2 medical students in each breakout room. So if you give me just 1 minute to do that, I will be back on and we'll send you into your room. So thank you all for being here, and give me 1 moment.
Hi there. Good morning.
Hi, we're just finishing up our breakout rooms and then we'll come back.
Perfect. Thank you.
Thank you for being here. It's Faye, correct?
Yes.
Okay.
Nice to meet you.
You too. Thanks for being here.
I
Okay.
tried to like create some slides and stuff, but I mean, I have a PDF of just like it's literally like a black and white. Um,
Yeah, that's fine. You're welcome to share your screen. If there's something
okay.
you want to pop up there, that's totally fine. When they get back into the room, I'll probably give them just a couple minutes to run to the restroom,
Okay.
and then we'll start at 11.
Perfect. Thank you. I've never shared my screen, so. Can you see that okay?
Yes, looks good. Welcome back, everyone. Thank you all. Well, please, everyone, say thank you to our medical students for sharing their story and their journey and their ups and their downs. We appreciate all of you being here. Thank you for taking the time. We know you're very busy, so thank you for taking the time to talk with our students. We appreciate you, and good luck on your next step.
Thanks,
All
everyone.
right. Okay, so we are going to get started in a couple minutes. I'm going to give you, we have a couple minutes before 11. So you can turn your camera off briefly if you need to use the restroom or grab some water. Come back here at 11. All right, everyone, welcome back. You guys want to jump back on? We'll move on to our next speaker. All right. So Faye Solares is a dental hygienist. She's the AC Dental Hygiene Practice founder and clinical director with the Sacramento Valley Dental Hygiene Association. She's the co-chair of Continuing Education Committee and chair of New Professional Mentorship Committee. I'd like to welcome Faye. Please welcome her to the program to talk about dental careers, dental hygiene. Welcome, Faye.
Good morning, everyone. Thanks so much for inviting me to come speak to you guys. Yeah, so I have a little presentation that I wanted to share my screen on, and it's very, very rudimentary, so I apologize. I put it together just this week, but you know, it's always good to have a visual. So let me just share my screen real quick. Okay. Okay, so actually, let me make this bigger. Awesome. Okay, so as Sam said, I am an RDH, a registered dental hygienist. Does anybody, you can just raise your hands. Who do you know if you want to be in dental? If you are, you know, in this program or in this room, the Zoom room, do any of you know whether or not you want to be in dental, in the dental field? Couple of hands getting raised. How about medical? And then how about you don't know yet? You have absolutely no idea, but you do want to get into the healthcare field. And that's totally normal. I just, you know, not too long ago, I was sitting where you guys were, and I didn't know. I had no idea that I was going to be where I am in my career now. So we have that in common. It's really, really, you don't always have to know from when you were little or even at the stage that you're at now, where you want to go. So, I have another question. Does anybody know what the AP stands for after the RDH AP, or excuse me, after the RDH in my title? Any guesses? If you want to unmute yourself without looking on Google. So it actually stands for alternative practice. So registered dental hygienist and alternative practice, meaning I was able to start my own company to deliver oral preventative services to patients. So that's what this slide is kind of introducing. Whether you want to be in dental, medical, anything in healthcare, even research and whatnot, your setting for your career may not always have to be in a building. And specifically for, or, you know, in the traditional sense of where it would be. Specifically for what I do, I bring that oral prevention care directly to patients with a bunch of different access barriers. You guys have probably learned about what barriers are. To name a few, there's financial barriers, obviously, people that can't afford it, people that can't afford insurance. There's also logistic barriers, people that are not, they're like homebound. They're not able to go to a dental office. There's also mental barriers. There's definitely a prevalence of dental anxiety. And that, which some of you might have, that can very much dictate whether or not people go to the dental office, the traditional dental office, even just to get routine, regular care. So that the license itself, the RDHEP license itself, it's been around since the late 80s, and it's directly addressing all of these barriers to care. Oh, here we go. Okay, so before I even go out there though and deliver the care, this is all the stuff that happens behind the scenes. Obviously, it's a lot of admin work, checking voicemails, returning emails, talking to patients as well as facilities to coordinate their care. I go into like scheduling, um, confirming appointments while I'm doing confirmations or even talking to patients that I have not visited before or facilities I haven't visited before. Um, I do like intake forms, send out intake forms, and then review them with the patients, especially if they have comorbidities, if they have kidney disease or things of that nature, where there might be some special details that I need to know before I can go there and render care, right? Because you want to continue to keep it safe for the patient, but you also want to make sure that you're doing everything that you can to deliver quality care, but that's also kind of individualized to every single patient. And then I go over kind of mapping out where I'm going based on, if I'm going to someone's house, if I'm going to an assisted living facility. Typically, what I like to do is obviously schedule because I'm traveling. I like to schedule kind of a more patient dense area. So that could be anything from like an assisted living or a skilled nursing facility to, maybe 5 houses, 4 or 5 houses in the same kind of neighborhood. So most of my day is actually rendering treatment versus, being in the car. Because in my car, it's not, as I mentioned before, it's a portable practice. So it's not anything like I pull up and they get into my van and everything's set. There's like a dental chair in the clinic in a van. That's not the case. Everything is brought to where the patient is, where they're typically the most comfortable. And then my clinical preparation, setting up all your armamentarium, all of your supplies, pretty similar to what you're doing whenever you are in the dental office or traditional dental settings. You just bring it all in, cases, and you make sure that everything is clean. So I have a little dolly that I have things in, almost like a big tackle box type of setup that I got from Home Depot. I restock, make sure that I have my list of patients. What treatment am I rendering that day? Is it a new patient? Is it, a deep cleaning? Am I doing sealants? Am I doing minimally invasive dentistry in terms of restorations? I need to know that because I need to know what I'm going to be bringing with me, right? So I restock all my clinical supplies, disposables like suctions, bibs, of course. And then I make sure that all of my instruments are sterilized, of course. That's, in line with keeping everybody safe and delivering this type of personalized care, but still very much upholding a very good standard in infection control. And then I pack everything up, a dental unit. They have portable dental units. I don't know if you guys know this, but they have them and mine basically looks like a carry-on luggage that you kind of just like pull. And it has wheels and it has a tiny air compressor in it. It has 2 reservoirs. It has a reservoir for clean distilled water, and then it has a reservoir for dirty water. It's got a suction tube. It has also a line for if I need to use a Cavitron or an ultrasonic cleaner for really, really hard or tenacious buildup. And also another line for a polisher, which I don't necessarily use all the time. I actually prefer using a polisher, like when they kind of brush your teeth and polish your teeth after a cleaning. I use that. It's just handheld. I like to use that where it's not connected. But there are a bunch of different, units out there. In terms of carrying around my equipment, though, that's stuff that there's nothing specific necessarily. Um, but it's you make it work. You just have to stay organized and figure out what you're going to need, figure out what clinical supplies and instruments you're going to need. And then of course, double check, triple check everything. The last thing you want to do is head out and forget a little tiny detail of something that you might need, whether that is, like a bib clip or a clipboard or even like extension cords. There's some places that where you're going to be setting up to render treatment, there's not always going to be like an outlet or something right there, specifically so that you can render the treatment there. So having that kind of adaptability and foresight in what you're going to be doing really does make things go a lot smoother. You don't waste your time. You are getting paid. You're paying yourself, of course, or I am, but you don't want to waste any time. Having to go back to your car. Oh, I didn't bring this. We can't do this treatment today. Things of that nature. You just want to, again, be organized and then think ahead. And then when you're there, wherever it is, a facility or, a house, you definitely want to create a safe treatment area, just like you would again in a traditional dental setting. You don't want, and this is kind of the cool thing about what I do. You kind of walk into it. Of course, if this is not a continuing care type of patient, and you're seeing them for the first time, or you've never been to this facility or this house or what have you. This is what is kind of cool for me. You basically have to figure it out, right? You have to adapt. Where's the best place that I can place this patient? Where, based on their capacity, do they have mobility limitations? What are their needs? So that I can make sure that they're comfortable, but also that I'm comfortable. I've been in dentistry for about 20 years, and knock on wood, that anything happens to my back or my hands or anything like that. Though these are the money makers, right? So I want to make sure that I'm sitting properly, as ergonomically correctly as I can. So not only am I doing so, I'm also doing that for my patients. Most of the time, especially when I'm working with an elderly population, it's very, very difficult for them to sit all the way supine. So, sometimes I'm rendering care and I'm like Spider-Man. I'm like, doing it upside down, or, you learn different operator positions, clinician positions, so that it's comfortable again for you as well as the patient. I do have these barrier kits. That's one of the things in my clinical setup. It's basically, again, when you've gone to the dental office, it's, a cover for whatever seat that they're on, plastic cover for where you're going to be putting your instruments. You do your best with what you are given, and it's almost like the less items and things that you bring with you, actually, the better. You just want your essentials, obviously, for actually, providing the care. You don't really want any of this extra stuff because you might leave it. You may not have a place to actually put it, things of that nature. And then of course wheel in all of your portable equipment and whatnot. And then the biggest thing, the most critical thing, is maintaining infection control and patient safety. Again, not just in terms of the patient's capacity to, the treatment that you're giving them, but you have to have a lot of integrity in doing this job as well. You're not going to be really watched by anybody. Sometimes there are caregivers there, but they're like doing other things. They're on their phone. So if you drop a suction tip, don't just pick it back up and use it. You have to really maintain that infection control. That's kind of what sets all of this career path and this company kind of apart from somebody just kind of doing it without having that in mind. Again, you are there for the patient, you're there to give them care. So you want to make sure that there's way less cross-contamination that's happening. Because you can imagine in these types of settings, a lot of that you have way more propensity to get cross-contamination occurring, not just from your stuff to the patient, but from the patient and the facility to you. So making sure everybody stays safe. So it's a good experience for everybody. And then when I'm with patients, it's another part that, this part I feel like you don't necessarily learn in schools. You always want to be respectful and all of that, but this part of the career or the job is really focusing on relationships and building trust, building rapport with your patients, and reducing, again, dental anxiety, super prevalent. Sometimes even when you bring the care to them, they're still very hesitant. Some of that hesitation can come from shame. I don't want them looking in my mouth, this and that. So kind of leaving yourself open to, again, adapt to people's capacities, whether that's behavioral capacities, physical capacities, all of that. These are all little details that, again, I don't necessarily think you learn while you're doing your schooling. You learn this by actually going to work with patients, whether that's on a volunteer basis and what have you. So the biggest thing as well is clear communication. You have to think about the patient that you're working with. Obviously, elderly, you want to speak a little slower, more clearly, make sure that they have their hearing aids on if they need hearing aids. If they are deaf, if you need somebody to sign for you, make sure all of that is situated so that, again, you're not necessarily wasting any time and the communication is very clear and transparent. The biggest thing too, on top of the clear communication, because this happens while you're communicating, not just verbally, but with your body as well, your body language, is to always respect the patient, make sure that they feel dignified. Especially this older population, some may be dealing with, just having a stroke and just recently losing the ability to hold things with their hands or move one whole side of their body. These are ailments and things that happen degeneratively, right? So which is you're going to deal with that no matter if the patient is older or not. So you want to make sure that you take that into consideration when you are rendering care, when you're giving them oral hygiene instructions, things of that nature. And they respect you back. They definitely get a sense of, wow, this person, they're not limited. They're not seeing me for my limitations, so to speak. They're not seeing me for the things that might be shameful for me as a patient. So, and again, older patients, some have a hard time kind of relinquishing the fact that they are not able to take care of themselves as well. So and you kind of get a sense of that. Some patients really want to keep their independence and whatnot, and again, that's part of the adaptability of when you're talking to patients, as well as when you're rendering care and then giving them instructions on their hygiene and their home care moving forward. Overall, the whole idea is, again, building that rapport. You want to have long-lasting relationships with these patients because at the end of the day, that, at least in my perspective and my experience, having that trust, having that relationship with patients, they are gonna, again, trust what you are asking of them, especially for what I do. I believe it's a teamwork effort, right? Because I am not with the patients every day looking at how they're angling their toothbrush, looking, how often are you doing this? How often are you doing that? I'm not with them all the time. So I make them accountable as much as I'm accountable as the professional. But it's something where if they don't trust you, they're not going to listen to your recommendations for the most part. So, and I've had patients where at first it just seems like they're lazy. They're like, not taking my plan or, oral hygiene instructions. But then when you get to build that rapport, it kind of just slowly breaks down and into a more trusting environment. And that's what's rewarding for me, is that not only do you kind of break through this barrier between you and the patient, but you also see them getting healthier as a result of it, which, again, if you're in this Zoom meeting, this is probably something that you're, interested in being a part of. So again, very, very integral in doing what I do. And then after treatment, just as you were, maintaining a very strict infection control protocol, You also want to do the same thing when you're cleaning up, because usually after treatment, there might be blood, there might be saliva, OPIM, other, material that is around and about that you can't necessarily see. So you want to make sure that you're putting things away. When you have sharps, you want to make sure you have a sharps box, like a portable one, that you're properly disposing of those things. Label things, label biohazard bags, all of that. So again, it's very different in terms of setting from a traditional dental office, but the standards are very much the same, if not stricter, because of the fact that everything is portable. And then again, this is just maintaining patient safety as well as the safety of yourself and then others that are in that facility. A very important thing too is there's actual rules to transferring instruments and whatnot. That's why I use cassettes. They basically look just like a cassette, and you have the instruments inside there, and it's like a hard kind of case that you can shut, put in another, little box that has a cover or a locking mechanism on it that has biohazard, labels on it, so that you're safe while, you're traveling. God forbid that you get into a car accident, you kind of just have instruments kind of strewn about. If one of those instruments goes and flies into somebody's eyeball or something, then, you are very much liable for what happens to that person, not even your patient, right? So always maintaining some strict safety and infection control standards. So this says my career didn't follow a straight line. It didn't. I mean, I was just like you guys. I was in we called it a cooperative class, and when I was a junior in high school, it was basically like, what are you interested in? And then they would put us into those fields kind of as interns. And then we eventually would get paid, but we would intern in, fields that we were interested in. So I began as an administrative assistant for a dental clinic. It was actually the dentist I worked for owned like 7 practices, and so he centralized his billing and his coding kind of like department. So that's where I worked. I never saw my first kind of run at dentistry. I never saw a patient. I was actually the one calling them, confirming appointments, talking to insurance. I never saw a patient face to face. So and then I ended up finding out from that I don't like that. I don't like, and because a lot of the patients would be very irritated, especially if I would have to, be collecting money. They didn't like the fact that somebody that they hadn't even seen at the office was calling them to say, hey, this is a bill that you owe. Can you pay me, please? Type of thing. So that part I didn't really like at all. I realized from that job that I wanted to connect with people on a better level. And so I went to school to become an assistant. And I did that. I got my license. I became a registered dental assistant. I got my certifications with that. I did that for about 12 years. And while I was doing that, I was taking classes to either become a dentist or a hygienist. Kind of long story long. I ended up having children while I was going into dental hygiene school. So I figured, you know what, this is probably the best kind of avenue for me right now, because I'll be able to balance things a little bit better. But I still continued taking pre-dental classes. And when I was ready to start applying after I took my DAT, I actually decided, I was already practicing as an RDH. I decided that prevention and doing like the oral hygiene aspect of things was actually more of my passion, versus I just figured restorative and, doing all of that. As a previous RDA for over a decade, I just figured, yeah, the natural progression is to be a dentist. And I do love doing restorative. I was trusted with a lot of different tasks when I was an assistant. The dentists that I worked for were very, very good in terms of mentoring me. And, again, that's what I thought I wanted to do. And this is again after, being in it for being in the field of dentistry for over a decade. And then after, practicing as a hygienist, I went, you know what? That's actually not what, at least at the time that, I made that decision, that's not what I wanted to do. So, that's why I went back to school and I got my AP license. And I just got my AP license pretty recently. Mind you, for all my ladies out there, or anybody that's planning on having children, I did this, started this business well, she was 4, my daughter was 4, and my son, I had just had my son like a year before. So it's definitely something that, again, it doesn't follow necessarily a straight line. There were, breaks within schooling. There were times where I was like, do I even want to go to dental school? Do I even want to go to hygiene school? But you end up, again, because you're out there either volunteering or in different settings applying yourself, that's where you're really going to find out what you want to do. And for me, it was the educational part of dental hygiene that I really, really liked. That's kind of where I found my calling, so to speak. And that's why, I started my own mobile practice and I'm at where I'm at now. So kind of piggybacking on what I just said, the purpose of what you're doing matters. There is a lot of, I'm sure you've heard, there's a lot of, practitioners out there, whether they're in hospitals, they're a chiropractor, they're this or that. There's a lot, especially if you're working in a hospital, there's a lot of this idea of even new grads and new professionals kind of burning out. And I mean, I think it's a real thing for sure. But again, in terms of prevention and trying to be more uplifting and more positive, you have to really take the time now while you're still young, while you're still, supported by your parents and a good support system to really try to figure it out. The only time that you will start getting your kind of vision and clarity on what you want to do in the future, the only time that comes is when you're applying yourself, when you're out there in front of patients, shadowing, doing things of that nature. That's really what's going to show you versus, reading things in a book, even listening to someone like myself. You have to apply yourself. Everybody's very different. Your skill sets, what you want to do in life, what your goals and your passions are. They can vary very much. So by putting yourself out there, you are applying your skills, you're learning more adaptability. Overall, you're also just gaining more confidence. There's way more confidence that comes when you're out there, right? When I first started as an assistant, I was very, kind of shy, very soft-spoken. It was like I was always asking the dentist, like, "Oh, am I doing this correctly?" Now, it took a while, working with patients and whatnot, but now I'm very confident in what I do. And to the point where if, a patient has a question for me, it's not something that, or like, "Oh, why are you doing this? Like, why do we need to have fluoride?" or anything like that. It's not anything that, you take personally, especially if you trust again in your skills and in your knowledge, right? So, and you only get there once you apply yourself. This is a field, whatever healthcare field you guys want to get into, this is a field that deals with people and patients. So, getting yourself out from behind a book and behind a screen, that's really what's going to shape you and point you in the direction that you want to go in. And then these are kind of my tips. If you're interested in this field specifically and starting a company like I've done, or even just working in a dental office, or going into some type of dental research, anything really, go shadow, go intern, help people out that you would aspire to be. And then this may even include people that you know, right? Your own practitioners, your own parents, your own, siblings, or, people that that you know, because then it'll make you more comfortable to like run through this like interview process and like kind of pick their brains, but then it'll make you more comfortable to start to widen that, right? Like starting to have conversations with someone like you don't know, like myself, on, what it is that you would want to do in the future. Again, explore different paths, right? I didn't really, well, I went and I interned at my mom was an RN for a very long time. I interned at the hospitals that she would be working at. And it was then that I realized I don't really want to work in a hospital setting. So again, it's never like you go into it just with a very optimistic view, then you'll never, even if you don't like see it through, it'll never be a waste of time. It'll never be, something that's not uh, cumulatively going to uh, show you where you want to be in the future. And as I said previously, communication matters more, if not more, than grades do. Obviously, with being in medicine and all of that, you want to start from a very good foundation. Obviously, you have to be logical and all of, those things and smart and savvy. But a lot of, especially what I do, is it's stuff that I didn't learn in school or in a book. And that part is the verbal and nonverbal communication that you have with patients. Everybody always gives off a little bit of a different vibe. Even I do on certain days if, I'm running on like 3 hours of sleep because my children have just been up all night, or, you always try to keep that stuff at the door because you want to go into it being very neutral. Patients are not, they're not obligated to do that, right? You're bringing them care. You are the one that's the professional. So, any little, difference in your tone, any little different body movement that you make, sometimes people are aware of that, and it could totally shut off, especially for what I do, the success of the appointment, the type of treatment I'm able to render, and all in all, the relationship that I'm trying to build with this person. Yes, definitely stay curious and again, open to things that you want to do. I have a lot of friends that went to medical school. And, from when we were little, we're like, I want to be, a gastroenterologist or an OBGYN, da, 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 da. And some of them aren't even doing that anymore. So it's not, again, it's not anything that's bad, but it is something that you have to think about in terms of you have to take it as a whole, right? Take all of the experiences that you have as a whole. That again, that'll help you with your decision making moving forward.
We're pretty close to time.
Okay.
All right.
Not a problem. And then these are just my final thoughts. And then if anybody else has, or if anybody has questions for me, or wants me to go back to a specific area, like a specific slide, then I'm happy to do so. Again, thank you for inviting me.
Definitely. Well, we're a little bit over our time, so I have to move on to our next speaker.
Not a problem.
I want to thank you so much. This is an area that we love to cover because a lot of folks think, okay, healthcare, it's doctor, nurse, but there are lots of other careers, and this is particularly unique with your business. And I really appreciate you taking the time and sharing that with our students. And do you mind if I share your contact information if they have further questions?
Not at
about it?
all. Yes,
Okay.
definitely email me. Don't hesitate. Whether you want to be in dentistry or not, I'm a good resource for sure.
Fabulous. Well, thank you so much for your time
I
this morning,
appreciate it,
everyone.
guys. Sorry for going over, but I'm
That's
clearly just
okay.
very excited about what I do.
No, this is great. Thank you so much.
Thanks, you guys.
All right. So we'll move to our last speaker of the day. So Dr. Heather Thompson, she is a licensed speech and language pathologist and professor and the department chair of the Department of Communication Sciences and Disorders at California State University in Sacramento. And since 2015, she's taught, and since 2021, she has served as faculty coordinator for the second bachelor's degree in communication sciences and disorders offered through the College of Continuing Education. So welcome, Dr. Thompson. I see your slides, but I don't see you.
I was muted. I'm
Oh,
sorry. The
no problem.
captioning was showing, but I was muted. Hi, everyone. Good morning. Yes, my name is Heather Thompson. I have been a speech language pathologist for over 22 years. I learned about speech language pathology when I was taking an undergrad class in the psychology of education. And at that time, I was in a workshop. I was interested in learning about education. I was interested in being a teacher. And so I was taking classes that allowed me to do an internship in the schools, working with children with a range of abilities. And what I found I learned the most on that internship while I was working in a grade 6 classroom was that I really enjoyed the one-to-one opportunities to work with kids with special needs. And so at that time, I learned that same semester that the Board of Education couldn't hire enough speech language pathologists to provide support to children with autism. And so at that point, I realized that a speech language pathologist works one-to-one with kids, works with children newborn through to adults, older adults, on their communication skills. And that because the same mechanism that's used to promote communication and talking, our mouth, our lips, our lungs, our mechanism that we use with our airway, we use that system for not only speech and language, but we also use it for swallowing. Speech language pathologists are also the clinicians that provide care to patients to maintain feeding and swallowing abilities. This is really important in hospital situations when kids may have a head injury or have adults who've had a stroke. That type of brain injury can sometimes take out a person's ability to take food by mouth. And so speech language pathologists are important for helping people to regain their ability to eat by mouth. So talking and eating are my two favorite things. So I thought this is the career for me. So our department, we have Department of Communication Sciences and Disorders at California State University, Sacramento. But we're one of 23 schools in California that offer training for speech language pathologists. It's a clinical and educational profession. And our goal is that we're going to train professionals in speech language pathology and audiology to provide a rigorous clinical background so that they can go off and be clinicians. So we're the largest college on campus, the College of Health and Human Services. Our department is 94% female, but we are always wanting more men to our program. We have the highest four-year graduation rate in the college. So we have a through in 2 or a completely done your degree in 4. I'm going to talk about audiologists as well, because we also train audiologists in our program. So who are they? So audiologists are healthcare professionals who provide diagnostic services. They manage and treat problems with hearing and balance and other types of ear problems. Audiologists are also in our department. They work with individuals who are newborns, little itty bitty babies that are in the neonatal intensive care unit, all the way through elderly, older adults. They perform hearing assessments, fit hearing aids, do different hearing aid management programs. They design hearing conservation programs for workplaces, and they also support with people's balance if they have problems in their middle ear that causes them to have difficulty with balance. We also, audiologists work in hospitals, schools, universities, ENT clinics like ear, nose, and throat clinics, physicians' offices, private practices, the military, and research hospitals. And so audiologists will do assessment and treatment of auditory processing disorders. They'll evaluate people if they have ringing of their ear or tinnitus. They'll provide evaluations and diagnostic services if they have hearing loss or vestibular problems. They'll help turn on cochlear implants. So have you ever seen those videos on on the internet with a little itty bitty baby who's never heard anything for the first time, and the baby has had a cochlear implant implanted, and then they're turning that implant on, and the baby is hearing for the first time, and then everybody cries because it's such a joyous moment where the baby, is laughing for the first time and can hear their own voice. Audiologists will do that. And they also provide interoperative monitoring. So they'll go into an operating room, and if a person's having brain surgery or other types of surgery that involve the ear, the audiologist will be in the operating room making sure that that no nerves for the hearing get cut and that hearing is maintained through the surgery. So what do you need to become an audiologist? You need a bachelor's degree from an accredited institution, and then you need to do a 4-year clinical doctorate degree that involves 3 years of coursework and clinic, and then a 1-year full-time paid clinical externship. So it's a 4-year doctoral degree after your undergrad. But my thought is, hey, you're going to be 26 years old anyway. You may as well have a doctorate at the end of it. So you're 26 and you're graduating and going on to work as a doctorate of audiology. Okay. If you're interested, you can contact Dr. Laura Gaeta at our department, and her email address is l.gaeta@csus.edu. Okay, speech pathologists, who are we? We work with individuals from infancy through to older adults. Right now, I work at a hospital and I care for patients in the inpatient rehab unit. So kids, I only work with children. Kids who are admitted to the hospital after they've had some kind of accident, they've maybe been in a car accident, had a bike injury, had a fall. And I work on, after they've had their head injury, I work with them to help them regain their ability to eat by mouth, swallow safely without taking food into their airway. And they also help them with cognitive communication. So that means like their thinking and memory and language skills and ability to answer questions. I work with patients who speak any combination of languages, so English plus anything else you can imagine. And my goal is to help make sure that they can communicate in their languages that they speak. I work with people who have autism, feeding problems, maybe people who have stuttering, neurological concerns, people who have cochlear implants. I work with people who have swallowing or speech and language disorders, and also voice challenges. So if they have a harsh or hoarse vocal quality, I help them to regain their vocal skills so that they sound nice and clear and they aren't having to work too hard to produce their voice. We work in schools, hospitals, rehabilitation centers. We work in skilled nursing facilities with our older adults. We also own private practices. You can work in teletherapy and universities as educators and researchers. And so what do you do? So for that, I'll tell you a little bit about the degree that you need. So my experience was I was an undergrad in psychology, and then I went and did the classes that I needed to do a master's in speech language pathology. But you don't have to do that. There's other things you can do. You can do an undergrad program, and then you can become a speech language pathology assistant. And that allows you to work as under the license of a speech language pathologist, helping them with providing therapy to kids in schools. You could also work as an audiology technician, helping to do hearing screening in the neonatal intensive care unit. You can also work in a variety of administration positions in like the health insurance industry or public health administration. You can also go on to do a variety of different jobs with an undergrad in communication sciences and disorders. You could go into social work, nursing, school psychology. There's a lot of different things you could take after you do an undergrad in communication sciences and disorders. Okay, so I'm going to skip a little bit forward. So what do? We give services to people with a bunch of different concerns, including like people who have like maybe cleft lip and palate, maybe if they have an expressive language disorder, they have difficulty learning language. We also have a very large transgender voice therapy clinic. So we provide care to individuals who want to acquire a vocal pattern that's consistent with a female vocal pattern, or maybe they're transitioning to male. So we provide them services if they want to transition to a male gender. So we help with that. And that's a very big area of practice. What do we do? Okay, so if you're interested in doing an undergrad in communication sciences and disorders to become a speech pathologist or an audiologist, we have information on our website. You can also go to the Student Success Center at Sacramento State or any university to get information around how to become a speech pathologist or an audiologist. We provide academic advising, so come visit us. And we also provide career path advising, but I want to tell you a little bit about what you do. Okay. So we offer a bachelor's degree in communication sciences and disorders, so that's a 4-year program. We also offer a second bachelor's of science. So this is for students who have something, they've done an undergrad in some other degree and they want to come back and earn the requirements that allow them to become a speech pathologist. We also offer the master's degree, and that's a 2-year program after the undergrad, and that's the coursework that you need to take to become a speech language pathologist. And we also offer the Doctorate of Audiology program, and that's that 4-year program that allows you to become an audiologist. We have a speech language pathology assistant program as well, and that you take after you apply for it after senior year of your undergrad. And that allows you to practice as a speech pathology assistant. Okay, if you come to an undergrad, what do you need to take? Well, you're going to do 2 years at the junior college, earning your general education requirements, and then you can transfer to Sacramento State maybe. But we start our coursework for speech pathology and audiology in the fall semester of your junior year of your undergrad, so you've got lots of time to think about it and decide if this is for you. And in the courses that you're going to take, before you get to junior year are a course in human development across the lifespan. You need a course in Introduction to Statistics, a course in Introduction to Psychology, and then you need a course in American Sign Language. And once you have those 4 courses at the undergrad level, either through your junior college or at your university, then you would start the junior course sequence, and you would take these courses when you start in junior year. You would do courses called the Physics of Sound and Phonetics, which is really cool, especially for those of you who are interested in music. You would take Anatomy and Physiology of the Speech Mechanism, so you learn all about head and neck anatomy. You take a course called Language Science and Development, and you would take a course called Introduction to Audiology, which teaches you about hearing screening and the starting point for an audiology career. And then you would take courses in development and acquired neuro-language disorders, so related to brain injuries and how does that impact speech and language. You would take a class in articulation, so how to produce speech. And that one's really fun. I love that class so much because we all learn about how to talk. You would also do a course called Supervised Field Observations, and that's where you get to watch speech therapy and audiology clinical sessions to find out if this is something that you might want to do. And then you also take a course in research. So you do a research project with a group, and then you present your research about speech and language. Then in senior year, you take more advanced coursework. This is in your undergrad. You would take courses in voice and fluency. There's a specific course in autism at Sac State, and students love that. And there's also a course in assessment. So how do you do testing for patients who maybe don't speak very much? Like, how do you get them to talk? And then there's a clinical course where you're actually in the clinic with a graduate student, working with a patient knee to knee with them, and you are helping them to improve in their communication skills. And you work alongside a grad student who's ahead of you in that program. So it's very exciting, it's very hands-on, it's very clinical, and it allows you to work in an educational setting or in a hospital or medical setting. And then in senior year, at the end, you take a course called Oral Rehabilitation, which is really good for people who wear hearing aids or who have a cochlear implant. You take a course called Medical Speech Pathology to learn about how to work in the hospitals. And then because we need to do assessments with people, regardless of the languages that they speak, they might speak 6 languages, and I have to figure out all of those languages, even if I don't speak those languages. You take a course called Communication Disorder in Multicultural Populations, because we need to figure out how to assess people regardless of all the combinations of languages that they speak. So that is kind of a brief overview. As I mentioned at the beginning of this talk, I became a speech language pathologist 22 years ago. I've worked in hospitals, schools, I've worked in university clinics providing training to grad students. I've worked with hundreds of patients over the years. 99% of those people have been children, and I've enjoyed every moment and every child that I've worked with. It's a very rewarding career. It's a very meaningful career. It's a very clinical career. It pays well. I have great work-life balance, and I can take care of my family, and I can buy a house. It does take a lot of school, but those years of school, it seemed like a lot when you're looking down the road and saying, oh my goodness, 6 to 8 years of school, that's a ton. It's so fast because it's so hands-on that it does not feel like 4 to 6 years. It's fantastic. The training is interesting and engaging and hands-on. You're not just sitting there like listening to lectures all day. It's very applied. You're up and moving. You're interacting with people and learning while you interact with people. It's a fantastic career. So if you're interested in learning more, I'll stop here and take questions. But I hope you consider it because it's a great healthcare career. It's a fantastic career.
Anyone have any questions? Jillian.
Hi, Jillian.
Hi, okay. Hi, doctor. So one thing that like interested me in what you said is you said you work like with patients who speak multiple languages even though you don't speak them. I was just wondering how exactly that works.
Yes, absolutely. So you get several courses in how to do it, but I'll tell you kind of the brief overview. So if I have a patient, and let's just make something up, and let's say they speak French, Spanish, and English, and the parent says, my child is having difficulty learning language, he's not talking yet. I have to assess that child in French, Spanish, and English. I have to assess them in all the languages that they speak. So what do I do? Well, I could become bilingual and I speak French and English, but I don't speak Spanish very well. So I'll test them in French and Spanish, and then I'll test them in, I'll test them in French and English because those are the languages that I speak. But then I'll go on and test them in Spanish with an interpreter. And then I have taken many courses that teach me how to analyze the results of the tests that I give in all these different languages to figure out what is a language difference. So maybe that person just hasn't had enough time speaking one of the languages and they just need more exposure versus a language disorder, and that is that child or person has difficulty learning language in general. And let's just say they can't say the word water in Spanish, like they don't know that word. Then I check to see, do they know that word in English? If yes, that's great. And if they don't, and if they don't know the word water in any language, I go, is it that they don't know the word water yet, or they have difficulty learning the word water? So I try to teach them the word water. And if they can't get it in a certain amount of time, I go, this person is having difficulty learning language. They're having a tough time with. So that's a very simple kind of explanation, but it's like a giant puzzle and it is so fun to figure out. I've simplified it a lot, but that's the gist.
Anyone else? I have a question. Is it you work with a lot of children with special needs. Is that particularly challenging?
I love working with kids. It is rewarding. It's challenging at times because it really depends on you getting to know each child, each student to figure out what their strengths are, what their weaknesses or challenges are, and then ways that you can help them. So the challenge comes into learning about that person and what they need to best support their communication skills. And then, yeah, it's challenging, but in a good way. Of course, there's some days that you're like, wow, I wish that I had have done something differently in my clinical session to help this person more. And you always are constantly reevaluating what you could do better and differently next time. But it's rewarding and challenging. It's very meaningful work. Like I come home at the end of the day and I'm like, okay, I think I helped somebody today. I think they got better because of the work that I did. And and you hope that every day you help them as much as you think you did. Um, and then you don't find out right away. You have to give it a lot of time. So you might work with someone for several months, and then at the end you go, that person made a really good change, and they've improved a lot in their communication skills because of the work that we did. Um, and sometimes you only see them for a few sessions because they get discharged from the hospital, and then you might hear from them years later and find out that they did really well. So it's very rewarding and very meaningful.
What other like healthcare providers do you work with?
Yeah. So in the hospital, I work with a lot of nurses. I work with respiratory therapists. I work with occupational therapists. I work with physical therapists. I work with child life services because my kids that I see at the hospital, they need a lot of toys and things to do while they're in the hospital. So child life is coming in and bringing them all kinds of toys and fun things that we then use in sessions for therapy to get them talking. I work with the hospital kitchen to ask for certain foods that I'm working on with my patients because I'm trying to get them to take food by mouth and get so that they no longer have to eat by a tube. So I go in and I talk to the patient. I'm like, what do you want to eat today? And if they say pizza, I call the kitchen and ask for pizza. And that's what we work on in therapy is practicing eating pizza. It's really fun. And then in the schools, I work with their classroom teachers. I work with administrators to help with the individualized educational plan meetings. I work with other providers like nurses and physical therapists in the schools to help with like wraparound plans of care to help support children using language skills for the purpose of accessing their education. So it's a very different team, but it's very rewarding. And then I also do feeding therapy in the schools. So I'm working with like the cafeteria to get the food that we're going to practice on with therapy. And then somebody asked me in the chat what inspired you. I think I saw a question that popped up and then it's disappeared. Let me see here. Oh, what inspired my occupation? I really wanted a profession that paid well and that allowed me to support people first and foremost, and where I could use my skills in communication and leadership to help a person's quality of life be better. And the reason I put paid well first is because I was raised by a single parent mom. We struggled financially, and I wanted a career that had a name and that had stability and that I knew would be a job that I could count on to support me and my family. Because I just saw how challenging it was for my mom to raise two girls on her own. And I wanted to make sure that I had the ability to support my family. And so this really allowed me to do that. And then the other piece is it's very like you're doing work that's helping the community. And so there is so much meaning associated with it. So I hope that kind of clarifies my rationale. The other thing is to I can work part-time or full-time or overtime. You can do 2 days a week, you could do 5 days a week, you can do 7 days a week. So it's very flexible to the kind of life that you want to lead. You could do half days or full days. If you work in the schools, you work 7:30 until 2:30. If you work in the hospitals, you work like 8 or 10-hour shifts. So it's really very flexible based on what you want out of your life. Oh, and summer's off if you work in the schools, which is fantastic. Jillian.
I just realized, so you mentioned it several times now. If you don't mind me asking, how much are you paid? Like, what is your salary since you mentioned it?
Yeah. If you would start as a speech language pathologist, you're going to start between $88,000 a year and about 105. By the time you all get to your undergrads and grad programs, it's probably going to be $110,000 to $115,000 a year to start. Yeah. If I'm being transparent, I make considerably more than that because I've got a PhD and I've been doing it for 22 years.
Right. Well, thank you so much. We really appreciate you sharing this with us, and that was a great overview. This is one we added a few years ago. I know you've done this with us a few years, and this is a great addition because it's not something that everyone thinks about in healthcare. So,
Nobody knows
um,
about it.
right. So
Yeah,
thank you for joining us. We really appreciate you taking the time.
thank you.
And this is our last speaker for today. So our winner of the gift card is Zara Delgado Moore. I'll send you a $5 gift card. And you guys are it for today. And we will see you on Monday. You have tomorrow off. We'll see you on Monday at 10 a.m. Thank you again for joining us.